So we're doing an article from the BBC, and as you can see, IT failures are causing patient deaths, says NHS safety body. Now, if you've got eyes or indeed ears and you understand English, you can maybe figure out that this is a gross offence to the reasons why the National Health Service is a thing in the first place, to provide patient care. And if you're failing to do that, well then you're not doing your job properly. Let's go down the article. Here we can see urgent action is needed to address NHS computer failings which are causing harm to patients, the patient safety watchdog has told BBC News. Now, computer failings is quite a broad term. It does go into more detail further down the article, but let's go further on. The watchdog has evidence of patient deaths due to IT system errors. The government called the reports concerning and said it would work with NHS England to take necessary action to protect patients. A recent BBC investigation found thousands of hospital letters were unsent due to computer issues. These letters could have contained anything from sensitive data all the way to medical diagnoses for the patients. This could have been critical information that did not end up where it needed to. The Health Services Safety Investigations Body, HSIBB, says IT failures are among the most serious issues facing hospitals in England. So this is being put right next to the National Health Service wait times, which are already far beyond what they should be for a health provider. So that is really saying how serious these IT issues, failings, it says here, are. We have seen evidence of patient deaths as a result of IT systems not working, said interim head Dr. Rosie Bennyworth. I do apologise if I've butchered the name. Dr. Bennyworth cited the example of a patient who was found unresponsive and then wrongly identified by healthcare staff as to not wish to be resuscitated. So we've gone from potentially vital letters not being sent to the patient in a timely manner or at all, to a patient who has been found unresponsive being wrongly identified as to not wanting to be resuscitated. The IT failings, be it on the users or the IT system itself, has led to the death of a patient. So this is going directly against what the NHS is there for in the first place. This is definitely an issue that needs to be rooted out and solved immediately. Unfortunately, things like this typically take time to resolve. IT systems aren't built in a day. They're typically months and years in the making, and there's a lot of different factors that go into the successful usability of a IT system, especially in the medical field. Staff were unable to access information on the patient quickly through their IT system, which would have shown a mistake had been made, said the watchdog. So again, this could be due to either user error or IT equipment given to them that was simply not up to par, simply not powerful enough, or having that quick processing time or indeed connection to the database in order to provide the caregivers with the information that they needed in quite a short amount of time. These things can't take time, they have to be as quick as humanly possible. Here we have electronic upgrades. It goes into detail saying an NHS England spokesperson said £900 million had been invested to help hospital trusts upgrade electronic patient record systems to quicken doctors' access to information. Computer failings were found in virtually every investigation. She describes poorly set up and badly used software, with some systems incompatible with others. First of all, I'm not too sure what badly used software is referring to, if that's referring to the way the users are attempting to use it, is they're trying to use it in an incorrect manner, if they have not had sufficient training in order to properly use the IT system. But also, as you can see here, some systems incompatible with others. Now, like I said before, having a successful and coherent IT system, especially within a massive industry such as the National Health Service it takes years in order to get it right, but when it's done wrong, it's done really wrong, and it needs different parts of the IT system need to be compatible with each other. This is just a basic thing that needs to be done right from the get-go, and it hasn't. Now, further on down here, it goes into detail about other failings with IT systems. It names a few examples. A patient diagnosed with lung cancer but hadn't been followed up because of IT problems, who then died 2 months later. Another was given the wrong medication because of a mix-up, who then died 18 days later. These two examples are both examples of how an IT failing can go from a simple IT issue, which the average person might not associate with a tragedy, such as somebody dying as a direct result of it. Don't try to sugarcoat it. These are directly because an IT system either wasn't properly used or just had failed on a basic level. Now, throughout this article, you can see numbers being thrown around. NHS Foundation Trust launched new £450 million. We saw up here £900 million had been given for an electronic upgrade. These things can't just be solved with money. I mean, don't get me wrong, money is definitely going in the right direction, but it takes time. These things need to be done right the first time. You can't do these systems wrong and then go, whoopsie daisy, my bad. Here's some money, get it right next time. Before we move on, I just wanted to bring attention to this gentleman who, as it states here, after waiting weeks for medical test results, Mr. Daw, 54, was shocked to see 3 serious medical conditions, including cancer, on his NHS app profile. This brings to light a couple things. First of all, the NHS app profile is a gross offence to personal data privacy. The NHS are plastering this on an app that you then download on your phone. If you don't see something wrong with that, then dearie me. People really use the NHS app to find out the results of medical test results. I mean, you could be facing a cancer diagnosis and you're waiting to be told that through your phone. This is definitely something that needs to be a face-to-face meeting with your general practitioner, and I'm sure that is either an option or mandatory for cases like this, but the very fact that it is listed on your NHS app profile it's beyond me. There was prostate cancer, cirrhosis of the liver, and also pulmonary fibrosis. Imagine being told that on your NHS app. Like, one day you wake up and you crack open your iPhone to go look at your NHS app to see what your COVID test was, and it just says, oh, never mind, you've got cirrhosis of the liver, and also lung cancer. We don't know about the COVID though. Definitely not for me. If we scroll up here a little bit, we can see there's a link to another NHS failing. Go on here. Nottingham University Hospitals Trust failed to send 400,000 letters. So the Nottingham University Hospitals is a very, very large regional hospital in the Midlands, and the fact that 400,000 letters weren't sent is a foundational problem with the IT system and the way it's being used. A former employee has told a lack of responsibility over a new computer system. Now, pardon me for going off of track, but this lack of responsibility seems to be prevalent with not just within the NHS, but most, if not all, public sectors of the United Kingdom. If you go into any publicly owned company, a lack of responsibility and a big pit of money that just seemingly disappears is commonplace. This needs to change. I have no idea how that needs to be done, but a reform in the way these institutions and organisations are managed, I think, is going to be a large part of it. It needs to be a large part of it anyway. The Trust says a full investigation took place in 2017 and found no significant harm to patients, but it has now said it will carry out a review of that investigation and take any further action needed. The old mumbo-jumbo. covering their backsides in case something does go wrong, which it undoubtedly will. 400,000 letters. I mean, you can safely assume that most of those letters were just letting people know that their appointments had been moved, or a confirmation letter saying you are actually attending this appointment. But some of those letters likely had critical information that the patient needed to know. Overall, this news story is a stark reminder of the failings within the National Health Service and the ways in which it's failing in both providing proper training for the staff that needs to have access to the various IT systems, as well as the lack of funding these services are being granted. This is a gross misuse of public funds. You would expect any publicly funded organisation to be at the top of their game when it comes to the service of its users, especially when its users are medical patients and you're their primary medical provider. As I've said in the past, the National Health Service in particular is in need of a complete revamp in the ways in which it is managed, as well as a reallocation of IT resources. It's about time to stop outsourcing IT management and support and begin properly integrating both that and IT systems into one coherent system that possesses actual usability. Like always, what do you think? Please comment down below, like the video if you did, and subscribe to the channel for more techie stuff and other things in the future. Have a good day everyone, I'll catch you later.